You all to CAB2 ChatnChew. This is an idea, a concept that came out of our community advisory board here at UCSF, Helen Diller Family Comprehensive Cancer Center. It is not the core CAB, which is CAB1. This is CAB2. And this meeting is open to the public. We record these meetings. They're available on our website. And we hope that you will share the information. That is really the purpose. The two is because it's not CAB1. And the two is also because what we ask people is to invite two people. So once you're in our web, if you've registered, we have your email address. We're going to be letting you know what kind of information we're going to be putting out every quarter for the CAB2 ChatnChew. And we hope that you will invite two people so that we can grow the network over time. Today, we are going to be, really jumping into the first iteration of the working groups that our CAB has broken itself into and put together. Some priorities, and the first priority and probably the most popular priority that people wanted to check in with is training and navigation. And so for our efforts in the coming year, this CAB2 that we're having right now really meets the demand of what that working group broke out together, put their heads together and decided that they wanted to do. Understanding the importance of navigation, and also understanding and recognizing the fact that people don't get their cancer care in one place. They may be getting part of it at UCSF, part of it at another institution, and then a whole bunch of it out in the community. So we have a very special activity. As I mentioned today, it will be interactive, and we do want your input and feedback because we want our community partners to guide the way we do our work here at UCSF. It is not we're not receiving federal dollars, which are your tax dollars, to do and serve our own purposes. We really are committed to being responsive to the concerns and needs of the folks in our catchment area, which extends from Monterey County, the southern border, all the way up to Mendocino County and across to Lake and everything in between. So without further ado, I want to introduce our moderator for today's activity. She is one of our cherished CAB members, and that is Miss Amy Alaniz. Amy serves as the executive director of the Women's Cancer Resource Center. I'm sure a lot of you already know her, and she's responsible for the strategic organizational goals, administrative and financial management, fund development, and community building at WCRC. For more than 28 years, she has held progressive leadership roles within social justice, health equity-focused organizations, and is dedicated to community support in the fields of cancer care, HIV, substance abuse, and mental health. She has extensive experience in operations management and fundraising, and she serves as a member of cancer advisory boards at UCSF Helen Diller Family Comprehensive Cancer Center and at Contra Costa Regional Medical Center. She represents WCRC in 2 research study projects that are focused on understanding clients' lived experiences to advocate for systems change. So without further ado, I'm excited to turn the mic over to Miss Alaniz. And so I know I just want to say Zoom has changed their tools. And so somebody has selected their pencil and you're drawing on the slides right now. So just wanted to let you know, I'll try to erase it. And then I'm going to turn the mic over to Amy. Amy?
Here I am. Are
we go to the next, okay. and next slide.
I was waiting for the tools to be erased. Okay. Oh,
right.
This is great. I love that Zoom has new tools that we can play with. So this is fabulous. Thank you so much for that wonderful and warm introduction, Dr. Rhodes. And I think next slide.
So I just want you to know, I can't erase it. So whoever drew that on there has to erase it. My eraser's not so maybe the host can erase it, or make me the host and I'll erase it.
I will make you the host, Dr. Rhodes. I'm also trying to erase it and not having any luck.
Oh, this is wonderful.
All
Okay,
right.
well, I will go ahead and begin and we'll move through it as this is being erased. So our community advisory board is working on the 4 following priority areas: training and navigation, thrivership, equitable access to precision medicine, and improving the patient experience. This meeting today is going to provide a high-level overview of a variety of navigation services that are offered throughout the community. And we're really excited to be together. So we're going to learn from each other. We're going to hear about what we are all providing in the community with the hope that there will really be an opportunity through this to build a diverse navigation network. I think next slide. Yes, here we are. So we have a work group, training and navigation work group in this CAB. And so the names on the slide, Amy, Wilma, Roxana, Barbara, Olivia, Michelle, Kate, and Tao, are involved in the training and navigation work group. We've been working together for the last several years. And we came up with a larger CAB, we came up with a broad definition of what navigators provide. So our definition is that navigators in hospital and community settings assist and support patients, families, and communities to find resources and services they can access and may need through their cancer experience or journey, reducing barriers in culturally and community tailored ways. So we have some proposed activities for 2024. The first of which is to build a network of navigators, including Promotoro's community navigators, community health workers, hospital-based navigators. And then what we really want to do is host quarterly meetings so that we can expand the ways that we work together, learn about additional community resources, and ultimately strengthen the way that we are able to support our clients and patients in the community. Another activity that the work group guided is the development of a training and navigation survey, which is an initial landscape scan of the navigation programs and services that are offered as part of the UCSF Community Advisory Board, Joint Advisory Committee, and Office of Community Engagement Partners. The survey has helped us identify what exists and is allowing us to begin building a navigation network. And so far, we have 17 organizations that have completed the survey. To grow the network, we invite others with navigation and community health worker programs to complete the survey. The link is going to be in the chat and the QR code is on the slide. These slides will also be distributed after the event today. We will share future results of the survey out in future navigation meetings. Next slide, please. The names and logos on this slide represent all of the community partners with navigation or community health worker programs that our Community Advisory Board and the Office of Community Engagement are involved in. This is extensive networks. Many of us have worked together for many years, and we are really grateful for this network of navigators. We want to grow this network. So again, we hope if your logo is not here, we hope that in future meetings, you will join us and we will be able to connect with you for referrals and services. If you would like to join the network, in the chat, you can send your name and contact information that will be tracked today. We will get back to you. Or you can also send information to the UCSF Office of Community Engagement.
You want the next slide?
Next slide, yes.
And someone is chatting me that they cannot see the screen. Zoom does have a new feature where in the top left corner of your screen, it'll toggle between the shared screen and the view of the people on the meeting. So if you can't see the shared screen, you need to toggle back.
Thank you, Dr. Rhodes.
Mm-hmm.
So today we have a really special opportunity to hear from 2 clients or patients that have benefited from services, navigation services. And so first we have an opportunity, and she's here with us today. So I would like to introduce you to Sky Ward, who is a client of Women's Cancer Resource Center. And she's going to spend a few minutes sharing with her what her navigation experience was like. Sky?
Good afternoon. Greetings and respect. Can everyone hear me okay? Yes? Okay, great. I was diagnosed with stage 3 breast cancer in July 2019. The navigation services I received from Women's Cancer Research, Women's Cancer Center included office visits, being accompanied by, and Dolores, I hope you don't mind, I can't just say generic navigator. It was Dolores, a tremendous resource to me, who accompanied me to my medical office visits. She helped with note-taking while I was in shock and in a daze, especially those early days. It was just such a relief to have someone there to help me take notes. She helped with conferring and discussing treatment options. One of the things I appreciated about Dolores's presence was the breast cancer health center staff were already familiar with Dolores because she had been there with many other clients. And the impact that had on our meetings or my appointments was we got down to business. There wasn't any dismissing me or dismissing my concerns because, I had this person here. One of the things I found very problematic, and I still find problematic with Kaiser, is it's just this huge behemoth of an institution, and sometimes we're just a medical record number, unfortunately. And so having Dolores there really helped to empower me to show up for myself, but it also helped with the interactions with my medical team. I was also able to get referrals to complementary healthcare services like Tai Chi for cancer patients, also massage therapy. I was able to receive a small grant for my massage therapy. Again, it was just instrumental in those early days of the diagnosis to help me to stay calm, to help me stay focused. It was just instrumental. I received a Safeway gift card for groceries. I'm someone who lives month to month, and the added expenses of this situation was, materials, supplies, things I had to purchase was, it was challenging. So I was very grateful to receive a Safeway gift card for groceries. But most importantly, the thing I remember and I am most grateful for is the culturally competent individual, emotional, and mental support I received. It was just so calming and empowering for me to be with someone who says, yes, Guy, I understand that. Yes, Guy, we have women in our African American women's cancer support group who are going through the same thing. There are things about the radiation treatment, what kind of creams we put on our skin that may be different for African American women. And it was so beneficial and reassuring for me and to me to have that kind of culturally competent support. I want to also reiterate one incident that still comes to mind when it came to getting chemo, and we had to go through the training, and I got the cooling cap, and my locks did not fit in the cap. And it was really important for me to try to sort that out, figure that out. And Dolores was right there saying, well, let's try this, let's try that. And it became really important because the health professional, I think it was an RN, who headed up that section, she was not culturally competent. Let me just put it that way. She was trying to give me the generic instructions for how to go through this whole process for preparing for chemo. And it just did not suit me. It did not fit me, my hair, my situation. And it was really good to have Dolores there. The support network and the next steps in my journey. And I wrote this piece out because I don't want to miss anything, because it was the most important aspect of having a navigator, which is the most significant benefit I received during my access to WCRC services was relieving the burden on my family. My family lives in Southern California. I live in Northern California, and they all have family and work obligations. And when you get this diagnosis, of course, everybody's in a panic. People are scared. And the appointments sometimes would just come last minute. It's like, okay, we have an opening, come in and see the doctor for this or that, the other. And it was a huge relief to me and my family to know that there was somebody here who can accompany me to my breast health center appointments. Oftentimes, like I said, those appointments were last minute. Having a patient navigator allowed my family to tend to their own family and work obligations prior to coming to the Bay Area to see me. Once here, they were more relaxed and more available to me without the added stress of a hasty departure from Southern California. I also didn't have to assuage their fears because I could reassure them that I wasn't alone, that I had someone here to accompany me, to take notes, to help me make informed decisions. Lastly, again, I want to reiterate what was hugely beneficial to me was having a neutral third party to discuss my concerns, express my fears, process my feelings, and to objectively help me evaluate treatment options. The next steps on my journey, my last radiation treatment was February 2020. I remain cancer-free, give thanks and praises. I will evaluate my medication with my oncologist during my annual appointment with her this month, in fact. I continue to show up for my annual mammography. I participate in cancer research surveys and events like this as a way to give back. And I live daily with profound gratitude and a heightened awareness and attention to my overall health.
Thank you so much, Skye, for being here with us and for sharing with us today. It means absolutely so much to us. So the next person we will hear from via video, because he had a work obligation, is Stephen Thompson. He received navigation support through the UCSF Black Men's Health Committee and the Prostate Cancer Support Group.
Is this supposed to actually be a video, because there's no video controllers popping up on top of it?
Yes, it is. One moment, or we'll move on then and play it. Come back and play it.
Okay, I'll move on.
Yeah, it looks like it's embedded as a flat image. It's not embedded as a video.
Hello, my name is Stephen Thompson.
Voila. Can you hear it?
Yes, if you could turn it up a little bit.
Okay, hold on. Let's see. Let me go back and then go forward. If it's not louder, then I'm going to pop out and then reshare screen with share audio, because you may not be able to hear it because of the share
My name
audio.
is Stephen Thompson.
Is it too quiet?
2011, I was diagnosed with prostate cancer.
I can hear it.
Originally, my primary care doctor told me that my PSA was a little high, but he wasn't as concerned. He'd been my doctor for about 15 years. So I was really his chase. And I remember at that time I was about 51 or 52 years old, and I totally agreed with him. So I didn't have another PSA for another 3 years. I think I was right before I turned 55. I think my PSA at that time was 4.2. I remember going to a conference or a outing that was put on by UCSF at one of the black churches. And I met a gentleman named Gerald Green. And I told him about my 4.2, and I said, I'm not going to pay attention to it. And he's like, oh man, I wouldn't do that if I was you. And I said, and I liked what he had to say. So out of respect, I said, well, let me go to the men's black men's cancer support group, which I attended the next meeting they had. At that time, it helped me to become more comfortable with my diagnosis because I found men that were going through the same thing. I had already gone through to pursue what's available to them. A lot of men that we laugh, we talk, I said, oh man, I wasn't able to do nothing. He helped me save my life. And hey, the support group helped me save my life. I'm in the support group, part of the men's health committee of Alameda County, part of Friends of Frank. And Dr. Rose, whenever she tells me, Steve, I need you. I'd like for you to show up. I always show up, and I don't hesitate to talk to men of any nationality. But my primary focus that I work with right now, because of the disparity of in healthcare, are African American, Latinx, and Pacific Islander. I would say any man that's diagnosed with a disease, if you can find a support group, they help. Like I said, it helps pre-treatment, so that's like surviving, right? I'm almost 6 years in at this point, and what the remaining in the group helps me to thrive. Because anytime I'm feeling down or feeling a little low, it's always uplifting to talk to someone, and it's uplifting to support other men. So I advise any guy who has been diagnosed with the disease, if there is a support group, take that, stand up on your own, stand up and take that chance. There's nothing to lose. There's a lot to gain. Thank you.
Thank you, Stephen. Sorry he couldn't be with us here today in person, but it was absolutely wonderful to hear him share. And I think that hearing from both Stephen and Sky is a reminder of why we're all here doing this work, and feeling really grateful to be here in community with everyone. Next slide, please. So we now have an opportunity to hear from several folks that work in this area of navigation. And so I'm going to go through and introduce you to all of them by name and organization, and then we will get started. There's a lot of wonderful stuff to share here. So we are going to first hear from Amparo Martinez, who is a cancer navigation specialist at Zuckerberg San Francisco General Hospital in their cancer navigation program. And then we will hear from Jill Longcrier, who is a client services manager at Cancer Resource Centers of Mendocino County. And next, it will be Dolores Moorhead, Community Engagement Director and Client Support Clinician with Women's Cancer Resource Center. We will have Wilma Batiste, Health Ministry Leader, Neighborhood Baptist Church, San Francisco, and Chair, Faith Communities Committee, and Abundant Life Health Ministries Network. Tao Wei, co-founder, Regional Pacific Islander Task Force and Commissioner, Asian and Pacific Islander Affairs. And Maria Lemus, Executive Director at Vision y Compromiso. So without further ado, I am going to hand this over to Amparo.
Hello, everyone. I have a PowerPoint. Let's see.
We have your slides. Do we have the next slide to start sharing Amparo slides?
Okay. Thank you. So thank you everyone for being here this afternoon. My name is Amparo Martinez, and I am with the Cancer Navigation Program here at San Francisco General Hospital. I am one of the navigators. Can we go to the next slide? This is our team. We are a team of 6 right now. We have Barbara Cicerelli, who a lot of you already know. She is our program director. We have Bryant Lee, who is our health program coordinator. We have Lily Zhang, who is our cancer navigator, bilingual in Cantonese. We have Vanessa Soto Holloway, who is our cancer navigator, bilingual in Spanish. And we have our senior clerk, Gina Tovar, who is also our bilingual senior clerk. And so our team consists of us, and what we do is we can go to the next slide. We serve oncology and breast cancer patients. We serve a diverse population who are low income and underserved. We serve clients who are who have limited access to care, who have financial, cultural, and language barriers. 50% of our patients do not speak English. We encounter clients who are facing homelessness and marginal housing and multiple comorbidities. Next slide. So what does our cancer navigation team do? We conduct through intakes. We meet with clients. We go into their medical appointments. I listed a bunch of a list of things of what we do with our clients. We empower our patients. We help them when they have food security. We help them with transportation, with psychosocial support, with the healthcare systems who seem to be getting a little more complicated every year. Insurance, interpretation, understanding, making sure that the patient knows and understands what the doctor is saying. And if they don't understand, then we rephrase and help them understand what their diagnosis is. We communicate between patient and provider. We accompany patients to medical appointments. We refer them to community organizations, and any additional support that we probably don't have in-house, we can try to find it outside with our community members. And prior to COVID, we used to conduct home visits when it was necessary. And I want to invite Barbara Cicerelli to share and talk about this image on this slide, because it's really important that we hear it, because all we see is just a picture. But when you hear the little story behind it, I think it hits home. Barb?
Yes. Hello, everyone. I think Napara wanted this picture in because, as she said, prior to COVID, we did home visits. And this was a home visit that I did. And the whole purpose of the visit was the client was at the end of her life and wanted to fill out paperwork and needed some assistance in doing that. So when I went to her apartment, she was pretty down and low. And I just said, okay, why don't we, talk a little before we do it? And she said, you know what I really want to do right now? I want to go in my closet and try on hats. So for the entire hour, she had like about 50 hats. We put on different hats, and that's what we did. She just wasn't up for doing the paperwork and so forth. So we just wanted to give you, we're often, thought of as a hospital patient navigation program, which we are definitely, but there's a component here that what we do, we haven't resumed the home visits yet because of post-COVID and things, but what we do is when patients have appointments, say at UCSF or other facilities, as Dr. Rhodes mentioned that most patients don't get their treatment here at one facility. We partner with UCSF. A lot of times the navigator will go to that, at least the first visit, if it's a radiation visit, and at least get them situated and comfortable with going to a new site. So it's the one place at the hospital that has a continuum of care throughout their cancer diagnosis. And I'll turn it back over to Amparo.
Thank you, Barb. So like Barbara was saying, we we have the luck to be able to go into the hospital. So when a lot of our clients are having surgery, mastectomy, lumpectomy, and sometimes reconstruction, we get to go into the hospital and see them and make sure that their needs are met while they're in the hospital, or if they need anything afterwards when they're getting ready to go home. We help them apply for temporary disability and sometimes permanent disability. We kind of guide them through the process because a lot of, as you all or a lot of people know, it is a long process. So we kind of help guide through whatever they need. Support letters. We, again, because we're in the hospital, we're very close to their providers. So we are able to get letters for employers, for different needs that the patient may apply for. They need a diagnosis letter. So we are fortunate to be able to do that. Next slide. So what do we do for the providers? So we provide support to the doctors by making sure that our patients show up to the appointments, that they're on time. We consult about time, making sure that the patient is at their, if they have a radiation, that they're showing up to UCSF. If they have to get an injection at UC, we make sure that they get there. We troubleshoot with the patients and providers about any concerns or symptoms. So for example, if the patient ran out of their medication, they will call us. It's easier to call us than to find the doctor. So we'll message the doctor, they get their refill in, and we make sure that the patient knows that that refill is ready to go. If they have questions that cannot wait for the next appointment, we troubleshoot that and get that answered as soon as possible, because we know that it's a period of anxiety and we want to make sure that they're not waiting 3 weeks for that one answer, because it's really hard. We also inform providers about patients' current situation and address potential barriers. So a lot of the times, the doctor doesn't have a lot of time with the patient. So we want to make sure that the patient tells us everything that they need help with, and then we go ahead and let the doctor know, because they'll share with us more than they share with the provider often. Next slide. So I have 1 minute. I'm going to just summarize really quick. We work with a lot of community partners. I'm just going to name them real quick because without them, our work is not going to be able to be completed. We work with Project Open Hand, with Shanti Project, with Círculo de Vida, Nova 12, Pink Ribbon Goods, Bay Area Cancer Connections. Next slide. And La Raza Community Resource Center, American Cancer Society, UCSF, San Francisco Marine Food Bank, Chinatown Community Development Center, and Self-Help for the Elderly. All of these community organizations make our team to be able to provide a lot of the help for the patients. Next slide. And just really quick, our team is not just our navigators. We work with nurses, social workers, therapists, pharmacists, integrative therapy such as nutrition, massage, acupuncture, exercise, and support groups. Here in-house, we have a breast cancer support group in English, and soon we're going to be starting a Spanish breast cancer support group. And this is just a few of the pictures that we have of our group. And very important, we do have a walk that's coming up. It is for the Nova 12. It's Saturday, October 26th. I can put information on the chat. A lot of people donate money that goes directly to patients. So when they're in treatment and they can't pay their rent or pay their bills, PG&E, phone bills, groceries, this goes directly to them. So I wanted to share this in this meeting because it's going to help a lot of our patients that we're all working with. And I just want to close it out that to the world, you may be one person, but to one person, you may be the world. Thank you, guys.
Thank you so much, Ampara. Amparo, I'm sorry. We're not going to have time at the end for Q&A moderated. So I want to encourage all of you, put your questions in the chat. Amparo, if you wouldn't mind taking a look after and seeing how you can respond to folks either now or after. And then Jill will do, and the rest of the group will do the same for you. So now I'm turning it over to Jill Longcrier. I think you're on mute, Jill.
Yes, I am. Okay, can you hear me? Okay. You can hear me now?
Yes.
Okay, this is relatively brief, so definitely feel free to throw some information into the chat. So I am with the Cancer Resource Center of Mendocino County, and we are a true grassroots program that serves primarily Mendocino County, although we've been expanding out and serving Lake County and a little bit of Humboldt County recently. So, and that is my email. If you would like to email anything after, feel free to do that. So next slide. This is the history. We were founded in 1996 in the town of Mendocino, California. I actually work in the inland office of Mendocino County. Mendocino County is pretty large. It's as large as the state of Rhode Island, so it's pretty spread out. And in 1996, there was a woman named Sarah O'Donnell. She had several friends that had cancer, and she really went through cancer once with small children and found it really complicated. And when she had a secondary cancer, she just really was overwhelmed. So she got together with a group of friends and that also had either cancer or had gone through it and decided to do something about it. So they created this center based on this group's needs. And Sarah O'Donnell eventually became the executive director, which is of what is now our organization. Our organization is almost fully supported by community. We do have small ancillary grants that come and go that our director does pay for, but I would say 90% of our funds come in directly from fundraising that we do and community members. And we're thrilled to say 100% of our services are always free. We don't bill insurance and we don't bill the patient ever. So next slide. Patient Navigators. So I am a client services manager. Really all that is I am the lead navigator because I have the most experience. I've been doing navigation for about 9 years. So there's 4 of us, including myself, and my other 3 coworkers are all Spanish bilingual and bicultural workers. So that's been a change that's happened in our organization about 6 years ago. We're really thrilled about that. We serve cancer patients and their families. I have a particular interest in family members and run a caregiver support group because the caregivers often have needs, but we do meet patients, we meet them with their families, and we meet them one-on-one. We support Mendocino County as well as Lake and Humboldt County patients that are treated in Mendocino and occasionally Sonoma County patients. Okay, next slide. The type of navigation, I always say it's customized one-on-one because we really meet our patients where they're at. Some people come with extensive medical background. Some people have never been to a doctor. Some people are very comfortable in the world of medicine and some people are not at all. Some people have extensive support systems and some people live alone. Some people are housed and some people are not. So it's very customized. We do provide psychosocial, non-medical support. We work closely with medical field, but we are not nurses and doctors, mostly social worker backgrounds. We definitely do in-person accompaniment to oncology, radiation oncology, surgical, and some primary care physician appointments around the topic of either cancer or possibly even screening for cancer. A significant amount of our work is done in the area of decision support. So we will attend appointments to help people understand their diagnosis, their treatment options, the benefits and the risks. And we do practice what are called consultation planning. It's really sitting down one-on-one with the patient before they meet any of those providers to kind of brainstorm their questions, concerns, what they want the doctor to know. That really helps them have a little control immediately. And it really also gives the receiving doctor an idea of where the patient's coming from. And then we audio record and summarize the appointments and provide that within one working day to the patients. So they have a really clear understanding of what was said, kind of breaking down technical information and providing the written summary in an area that's in a manner that's really easy to digest and understand. And I will give credit to Dr. Jeff Belcora, who primarily trains our staff on that process. And we really just want to make sure that people understand all the options that are available to them and the benefits and the risks up front so they can really make informed, comfortable decisions. And kind of in this process, I think we're also modeling kind of self-care and how modeling with patients how to be their own advocate. And then a huge amount of our work is done in reducing barriers to treatment access, whether that is transportation or insurance, lack of insurance, et cetera. So we can go into that later, I think later down the slide. So next slide. So yes, medical appointment preparation, recording and summarize. We do that anytime we're asked. We do have many support groups. We have a English women's support group, a Spanish women's support group, a men's English support group. We do not have a men's Spanish support group yet. We have a client-led book group that chooses a book every 6 months to read and discuss. I run a caregiver support group, and we're missing a group. I can't think about it anyways. Can't think what it is. Transportation and lodging, we can help organize and we can organize the partnership transportation. We have our own volunteers that we can coordinate transportation through a volunteer, and we also do transport people to and from treatment ourselves. And lodging assistance, we can provide direct lodging assistance if people are traveling out of town, and we can also coordinate with other programs. Since COVID, we've really ramped up the telehealth assist and host. We are rural, so some people just don't have computers, and some people don't know how to use a computer, and some people don't have Wi-Fi. So we have a lot of people come in and sit down. We go through their chart and set up their Zoom appointments. We accompany it with them, but they're doing it in our office. And then we do, not a lot, I would say 10 to 15% of our time is out in the community doing cancer risk reduction education at events and with employers that employ a lot of people. Like we'll go out into the vineyards and talk to some of the migrant, farm workers. So next slide. We definitely do complex problem solving, as all of you who are here, whether you're a patient or a navigator, things come up and they're complicated. And so that's a lot of what we do is complex problem solving. It can be as simple as, multiple appointments scheduled in different areas to the same day to I have pets and I have to be in the hospital for a week. Can you help me? It's varied. We do a lot of insurance benefits assistance, whether somebody has insurance and they're underinsured, or they just don't understand their insurance, or they don't have insurance, or their income's changing and they need to apply for different insurance. We do a lot of education and assistance in that area. Income benefit guidance, certainly if somebody's needing to go on temporary or permanent disability, we understand the process. We can guide them and help them through that. We have resource lending libraries. We have 2 physical offices, one in Mendocino and one in Ukiah. And both of those offices have lending libraries that have a really nice collection of books and audios and materials to borrow. We have beautiful boutiques in both of our centers. We have hats and wigs that people can borrow, bras and prostheses that they can have. port pillows. We have cold mitts and booties for chemotherapy, surgery garments, a lot of items in those. Boutiques and everything, of course, is free. We did provide 7,951 individual services in 2023. And the next slide. Patients reach us through oncology referrals primarily. We have 3 oncologists in the area, one in Ukiah, one at the coast, and one at Lake County. We do get clinic referrals from our local primary care physicians, hospital referrals from when somebody sometimes is directly in a hospital, and self-referrals and community referrals, of course, walk-ins. Next slide. And this is who we served in 2023. We served 325 new unique patients and 544 total patients. And the reason there's a difference there is the total patients are people that aren't brand new to us in 2023. We were serving in 2022 and we're still serving them. The breakdown, 65% white Caucasian, 11% Hispanic, 2% Native American, 2% Asian, and less than 1% African American. Although our goal is to outreach much more of the Hispanic, Latinx population, because we know that population in our county is closer to 50%. So we're working really hard on the outreach. About 61% female. That I looked at the trends, that seems to be kind of the trend for us. 30%, 36% males, and 3% not reported. So again, an outreach is like encouraging men to trust us enough to support them. This last year is the first time ever we have not had a male navigator on staff. So we'll see how that plays out. We do provide services in English and Spanish. We do have some people that come in speaking Cantonese, which we do not speak, but we do have an oncologist that is really immersed in the Cantonese culture up here, and he really works with us closely. So yeah, next slide.
Okay, my cursor has turned into a marker of something different, so hold on a second.
Sure, I think we're getting close to the end.
Let me see if I can control it with my.
I will say, while you're figuring that out, some of the things I didn't touch on is like we definitely work with nutrition needs and food insecurities. We have a great local program that called the Caring Kitchen that provides organic meals that are delivered to people's homes free for 16 weeks. We work with that program, of course, CalFresh applications, Meals on Wheels, the food banks, but the Caring Kitchen is food that's designed specifically to combat malnutrition while you're in treatment. So I'll finish it with why we're proud. We're super proud that our services have always been 100% free. They always will be. We are community supported, which is probably the main reason I was attracted to this work. We also couldn't do this work with 4 navigators. We have 4 navigators. We could not outreach that many navigators and keep our offices going without volunteers. We had in 2023, 18 volunteers provided over 1,000 hours of service. And the future, we would like to impact cancer rates and cancer outcomes via ongoing support and screening and education. So that's kind of a big goal and much needed. So thank you for your time.
Thank you so much, Jill. Please take a look in the chat. I know you've been presenting, but there are some really wonderful questions that are coming your way. If you wouldn't mind responding, I just want to say it's wonderful to see all of this learning and networking happening through the chat through these presentations. So we're all learning things that are going to help us come back to our organizations and better serve our clients and patients. So this is really wonderful. Next up, I am introducing to you Dolores Moorhead, who is the Community Engagement Director and Client Support Clinician, and I get to work with her at Women's Cancer Resource Center. Dolores.
So hi, everyone. Next slide, please. So I was a navigator from the early 2000 into the pandemic. So I just want to say WCRC was really founded on providing support to women. It was started by Jackie Winnow and several women who got together because their needs weren't being met. So we're saying that we were serving since 1986 when the word navigation wasn't even being used. Our program in 2008 started prior to that because Catherine Brown came to us and was doing her dissertation based on Each One, Teach One for African American women, because she had looked at what was happening and the research that was being done about lay health workers and how it was changing the course of the disease when people had someone to go with them who wasn't in the medical field and who wasn't a doctor. So in 2008, building upon the program that Sister to Sister was doing around community health advocates, where individuals were going to doctor's appointments with folks, we then in 2008 decided to have a multicultural based program that included Sister to Sister and Latina services. And what this program allowed us to do was to provide equitable access to cancer screening, diagnosis, and treatment for a greater number of our low income and underserved individuals. With that, we were able to, as Sky mentioned, to look at this from a cultural standpoint, to really connect with individuals who needed to be seen and heard based on their culture and background. Next slide, please. So in our program, we do connect our clients with our social workers, their care team. We accompany individuals to medical appointments. And I also want to share in this time that while I was a navigator, I also went with women in the beginning, particularly if family members did not live in the Bay Area, with them to the day of their surgery. And I went with several individuals and was that key phone point for individuals whose moms were 80 and up and didn't live in the Bay Area. And so I was on the phone while I sat there in the waiting room, doing work from my laptop, being able to provide these family members with updates about their families. We also went into the hospital to visit when people were ill. We provide translation services, taking notes at medical appointments, scheduling those visits. Also, I want to say one of the things that happens when we are accompanying people to their medical appointments is being very mindful of watching the body language of the patient that is in the room and noticing when their eyes glaze over and they are no longer hearing what the doctor is saying. And those types of things are important. When words like palliative care are used, your cancer has advanced and returned, and we're working with individuals who don't really understand what that means, stopping and making sure that the patient feels empowered and the questions are answered. We also assist in completing and submitting benefit applications, referring to internal and external resources. We also coordinate communication and follow-up resources, meaning that we work very closely with the social workers, the care team, the doctor. Sometimes we definitely have to step in, even if we're at an appointment, like a chemo appointment, and the patient isn't understanding the necessary thing around being compliant. Next slide, please. Our populations that we serve are more than 65% of our clients that we see are people of color, and 80% are low income. Our services are all free, and we serve Alameda and Contra Costa County. When we break down the ethnicity of our navigation clients, 41% are Latinx, 30% are African American, 36% are African American, 14% are Caucasian, 7% are Asian, and biracial are 2%. I do want to add that during COVID, I would actually do telehealth because we weren't able to go. So that meant conference call, that meant being on the phone with that client so that our clients did not feel like they were lost and without support because we were not able to go into the hospital with them. Next slide, please. So here's some data, program data information. We do monthly surveys to measure how effectively the navigation program is, and are able to see, does it decrease the distress of our clients for our social determinants of health, including transportation, housing, and food insecurity. I can say one of the wonderful things that we have been able to implement is that we have a food program that our navigators are able to get their clients food, they're able to deliver it, and we are able to participate in reducing the food insecurity. So this information, as you will see, is from, sorry, I can't see that little, people keep saying stuff, from July 2023 to September of 2023, and from 25 navigation clients. Next slide, please. So our navigators are Dama, who focuses on the African American community, and Irene, who focuses on the Latinx and monolingual Spanish-speaking clients. While these two individuals have a focus, we see all clients who are in need of navigation, and to make sure that we are participating in educating them, supporting them, and reducing the barriers to care. Our volunteers are trained. We also have volunteer navigators who are trained, who work closely with our staff navigators in being able to provide that additional emotional and practical support services. As well, we do work with referrals to other partners and to provide additional information. And we know, just like we've said here, that there is no way that we could actually do the work we do and help the clients who are so in need without being partners to other individuals and other places. It's just actually what's needed is larger than what you can do all by yourself. So that word, it takes a village, is it does take a village. So thank you. Next slide. I think that's the end of our slides.
Thank you so much, Dolores. Our next presenter is going to be Wilma Batiste, the Health Ministry Leader for Neighborhood Baptist Church San Francisco and Chair Faith Communities Committee and Abundant Life Health Ministries Network. Actually co-presenting with Tao Wei, co-founder of Regional Pacific Islander Task Force and Commissioner, Asian and Pacific Islander Affairs.
Good afternoon, everyone. It's been a long day. I'm Wilma Batiste. I represent Neighborhood Baptist Church here in San Francisco, as well as the UCSF Abundant Life Health Ministries Network. Neighborhood has been a part of the Abundant Life Health Ministry from its inception. My pastor, Lane Hawkins, was among the pastors that met with Dr. Frank Staggers Sr. to create or invoke the Abundant Life Health Ministry. Our health ministry began at Neighborhood Baptist Church in 2006. Our church membership is about 250, and we are celebrating 79 years in November 2024. To put our health ministry together, I used all of the ministries within our church. In order to make it work, number one, we had to have our pastor who was in agreement, and all of the ministries to be what I call my navigators, that we had to work together in all areas. We are also considered as a commuter church because 85 to 90% of our worshipers live outside of San Francisco and they cross 2 bridges. So we are spread all over. We have 2 church vans that assist members that live outside of San Francisco County and coming to church and returning back home. During the pandemic, we also had people placed in all the different counties that served food, gave Bible study, went to appointments with our elders to make sure everybody was not left alone. Also here inside San Francisco prior to the pandemic, we had what we call a church ministry, where our mission and men's department went and gave church services and communion to the patients at Laguna Honda Hospital, who's over 100 years old here in San Francisco. We have continuously served food or taken food, delivered food to our shut-ins and elderly people. We attend doctor appointments, also my health ministry, and I say my health ministry because I love it like it's one of my babies, that we provide healthy eating, healthy meals, training, exercise, and during the pandemic, we could not meet in person. I started a virtual cooking class, of which we are continuing. Well, people are learning how to have healthy meals, how to shop, how to manage their money, to shop well, do exercise, all of these things, what I consider as being a navigator. Some people call it Nurses Guild, or you call it the URSHs, or you call it the what you call, not the RNs, the nurses prior to becoming an RN. We give the service that's required in all these different counties to make sure that our congregates are healthy, they're well taken care of. Myself, as being a researcher for UCSF for a number of years, I went with my prostate cancer patients when the meeting was with the family for the first diagnosis. At times, I would have prayer with them. I still, at this time, meet with people to go over things that they're not sure of. And when we're having screenings at church and they're not understanding what the numbers or the results are, I have books that I can sit down with them and show them and go with them and have them have a booklet they can take home with them to make sure they're safe and aware that they're being loved and cared for. And I think I've used up my time, and now I'll pass it on to Todd.
Thank you so much, Wilma. Has Tao entered the room?
No, not yet. We can move forward, please.
Okay. Next up, I would like to introduce Maria Lemus, who is the Executive Director of Vision y Compromiso.
Thank you. Can you hear me all? I hope you can.
Yes, we can.
Okay, good. Thank you. If I lose you, I am actually on the freeway going from New Orleans to Jackson, Mississippi, in the middle of a tropical storm. So if I lose you, that's why. But I'm really pleased to be able to be here. I can't show any slides because I'm in the car. But I would like to give an overview of Vision y Compromiso and the work that we've done, in particular outreaching, providing education, outreach, and navigation and care services to primarily the Spanish-speaking community. But you know, the promotor model has been really acknowledged in the last 2 years because of COVID and been called essential workers. But really, promotoras have been out in the field, in the homes, in the neighborhoods since I can remember, since my mother was a promotora, since many of you probably had mothers or aunts or grandmothers who were promotoras, always giving and sharing and reaching out to the community. That's the model of the promotora. It is that person with service of heart, espíritu de servicio. They're mostly volunteer. Historically, they've been volunteers. And so how we integrate the education, outreach, navigation, and care piece is with those great leaders. And we've been outreaching about cancer, in particular with women and now with prostate cancer, for many, many years. And I want to say outreach, but in fact, they come to us, and the way they come to us is in our meetings and in our trainings and in our advocacy work. And they come next to us and they whisper to us because they're still embarrassed. They don't know what's going on. And oftentimes it's too late. They haven't had a diagnosis soon enough to get treatment. So we started in the beginning talking about cancer, different kinds, breast, cervical, and the majority are women in the Central Valley, North, all over California. And the outreach is to talk about cancer, the different kinds of cancer. And so we integrated throughout all our work throughout the network, which is across all of California, from northern Modoc to Hayes, all the way to Imperial and San Diego and across the state. Talking about cancers, talking about go get a checkup. The difficulty exists in they don't have a facility near them to be able to get a checkup. And maybe they don't have insurance, and then they don't have a support system to help them if they're diagnosed or if they have to have some kind of treatment. We've in fact been involved. We have programs right now with education and the navigation of that individual in the community when they don't know what to do when they've been diagnosed, and we go with them. We help them. Much of what has been discussed, presented already, but we've even done for those who have passed on, we stay with them until they pass on, and then we even do fundraisers for the family because they can't afford funeral services. So it's almost from beginning to end, the education process, and then how are we with them along the path and hold their hand. And these are all promotoras who are trained. We have a program called Amor con Dignidad, which is love with dignity. We really, that was focused on death and dying, but now it's really starting in the beginning and working with the caregivers. And how do you support caregivers who are sitting next to a parent or a loved one who has cancer and is passing? Hospice is not really a reality for many of our community that we work with, and many of the hospice services aren't relevant to our community. And so we really have taken pieces of the path from diagnosis, education to diagnosis, to treatment, and then to the passing phase, and really honoring each phase and providing service to the individual as well as to their families. And now we're working. We just started a project, or we're going to start a project with prostate cancer for men. They have very few resources, very few services. They're not really screened for prostate cancer, and so we're starting that, and a support system for the family. I want to say that as much as we support the individual who's the cancer patient, we also support the family, those who are caring for that person. I think that I've heard great examples of caring for them through the exams and through the doctor visits, but it's so traumatic for the family. They don't know what to do. They don't know how to do it. They don't know how to provide a best service. It's so emotional, and that's a big piece that we have built out to be able to support them. We have training for caregivers and in that community, and so we're almost a full service agency. Providing this for the individuals. I think the saddest thing for me is that there still is not enough identification. There's not enough resources to be able to go get tests. There's not enough discussion about it. And so we end up finding and working with patients who have a late diagnosis, and it's not typically a good one. And so if the call to anything, and I'm not going to repeat what everybody else has done, because I think everyone that has presented before provides extraordinary services, and many of them we also provide. But I think what we need is to look at how do we go out in the community and really provide more early education, more prevention, more access to services. I think when I came onto the advisory committee, I mentioned that I had a meeting with I literally bumped into Dr. Staggers, who helped me get better, who helped me with my husband, who at that time had been diagnosed with prostate. It was a blessing because he referred us to UCSF. He was a Kaiser patient and got extraordinary care there. That is the exception to the rule. I'm so thankful for it, but how are we going to get these extraordinary services? I know we provide guidance all the way to the Central Valley. But the Central Valley has so few resources, so little access to everything. I think that for me, it is, while these are extraordinary programs that we've just heard, how do we replicate these across California and across the US? Not just for Spanish speaking, but for all of our community, especially our second, third, fourth generation, who think they're invincible. They really don't want to get tested. They don't want to do anything. Our English speaking Latinos. And so I think I have a lot to think about. How do we implement it? How do we get our medical system to really reach out a little more? How do they find CBOs like the one that presented before us and Vicente Compromiso? How do we really look at the prevention education side? That's our safe world. That's what we do: prevention, education, navigation, adherence to medication, care, supporting caregivers. But all of us reach only a few of those who should be reached, and we're good at what we do. I think the message I leave for everyone, because we're all great programs, is how do we replicate these programs? How do we get more services added to the communities? And while I say the hard to reach, promotoras, our community is not hard to reach. Promotoras know where to go, and the navigators know where to go. They're from the community. They know how to reach us and how to talk to us and how to counsel us and how to hold our hands. So that Vicente Compromiso, that's what we're doing right now, really focusing from beginning to end: education, outreach, navigation, and care. Happy to answer any questions, and happy for anybody that wants to call me or to email me. Thank you.
Thank you so much, Maria. We appreciate you taking this while you're driving. If anyone has any questions for Maria, please put those in the chat and we will make sure we get those to Maria. I have learned that Tao is traveling internationally and was going to make every attempt to join Zoom today and was unable to. So this will conclude the presentation. I want to thank all of the presenters. I think that it has been wonderful, first of all, to hear from patients and clients about how navigation has supported them through their journey. It has been really incredible to learn today about the hospital navigators and the community navigators and the faith-based navigators. And there's a lot of chatting going on in the chat. And what I'm definitely seeing is people want to know about each other. They want to know how to connect. And there's some themes. There's some themes around how could we work collectively together to advance and support and improve patient outcomes. So it's all very exciting and wonderful. We are now actually going to go into an interactive experience. We're going to go into breakout rooms and have an opportunity to get to know each other a little bit more, introduce ourselves, and then we want to keep convening. We want to get together quarterly and really build this network, our skills, our knowledge, how we will work together better to serve patients. And so on the right-hand side, you'll see some topics that have been presented in past meetings. And so we'll be asking you to introduce yourself, share your organization, where you are, what city you're in or what region you're serving, and then select a meeting topic that you would like to. So we'll come back in to this room. There will be a poll, and yeah, so we'll have an opportunity to see where everyone's really interested. Is there anything else I need to share before we go into the chats or the breakout rooms?
No, I think we're
Okay.
gonna go ahead and activate the breakout rooms. People can select to go to a breakout room, and then for those of you who don't know how, we're going to put you in a breakout room. You don't need to be in a specific breakout room. We just want everybody to kind of have a chance to mix it up and express their thoughts about these topics, which please take note of them so that when we come back into the room for the vote, as Amy said, you'll get a chance to complete a poll. So please stay with us. Please don't leave. We do want to hear what you want to see us do.
It actually means in terms of training the navigators, and folks from the work group can chime in. That is, if you have a navigation program and you're bringing on a new navigator or what have you, and you want to learn what other people have been doing to train the new person. You might not have trained someone in a while. That was what that was about. And then the program development TA is if you're looking for someone to help establish or give guidance or consult about developing a new navigation or community health worker program.
Thank you.
I think the theme that came up in our group around training was training that is specific to understanding how to access CalFresh or Medi-Cal or disability. So it was even broader, I think, than what we had envisioned when we did this as a work group. So, you know, we may expand on training at some point. Okay, so these are the topics that were identified by the navigation work group and the UCSF Community Advisory Board. And so our goal today is to vote. We've had a wonderful chance to connect in the breakout rooms and talk about these various things and where our interests lie. And so there's going to be a Zoom poll that's going to come up, and everyone gets a vote for your top choice, which we're doing in real time now.
Yes, we are. So if you see the Zoom poll, please vote. Just so you know, what's going to happen next is whatever the top choice is going to be removed from the list, and then we'll have a chance to vote again. So if you don't see your top choice when we share the results of the poll, don't worry, you'll have another opportunity to vote for your top choice in the second and third iteration of the poll.
Ranked choice voting.
It's not actually ranked choice because we're taking the person off the list once they win. Whereas ranked choice, you put the person off if they lose, and then you split their votes. We're not doing that. It ain't ranked choice.
No,
We've been traumatized in Oakland by ranked choice already. We're not doing ranked choice. So we're looking for, we've got 39 votes so far. We're looking for 40 votes out of 40. Okay, we're looking for 5 more votes. If you haven't voted, please vote. Hey, Rox.
Hi, I have a question because we had really good discussion in our breakout for items that weren't on the list. And I know I had Tananson in my room and I wrote down some of the awesome additional topic. No, I'm just wondering if there is time to share it. That's all.
I'll leave that to Michelle. We're looking for 5 more votes.
Are you the only group that has some additional things to share? Is there another group or?
Yeah, Sister Michelle, I personally would like to share from our group if there was others too as well.
Well, what I'm gonna have you guys do is put it in the chat, and then the work group will bring it up for discussion at the debrief of this meeting, because I think since there's multiple, there's no way we would have time.
Right, exactly. Millie, are you on a phone? No? Okay. I see your vote. I'm gonna enter a vote for you if you're unable to click the poll. Can you see the poll?
No, I didn't.
Okay.
I already voted in the poll.
Oh, you did? Okay,
Yes,
so
I
then you
did.
don't have to put your choices in the chat. You're gonna get to vote 2 more times. So next time, we'll see what's on the list, so you can, we need 4 more votes. We're at 91%. So if you haven't voted, please do. All right, gonna poll in about 10 seconds. All right, we're going to show you the results of the poll. So it looks like the winner with 28% of the votes, after 93% of folks voted, is training, tools and resources for navigators, community and community health workers. So that selection is going to come off the list. That is now number 1. The next poll you see is going to not include that. So congratulations for those of you who wanted that to be your favorite, chose that as your favorite topic. All right. Next poll coming up. You should see it on your Irene.
Yeah, sorry. I just wanted a little bit of clarification for payment and reimbursement system and infrastructure for services. What does that mean?
That means that the group, what that topic was, is wanting information on how you can set up what you needed to do to what you need to have in place in order to start getting reimbursed as a navigator or community health worker. What you need to have in place within your organization in order to be able to get payment and reimbursement for your navigators and community health workers.
Oh, I see. Got it. Thank you.
So Michelle, if our top choice on the last was not selected, do we vote for that again, or do we choose our
Yes.
second?
You vote for it again. Because
Choice,
you vote for it again. What you're trying to do is get your topic to be the focus of what we're doing. So, you know, you're not going to get, everybody can't have their top three. So hopefully you'll get at least one of what your top three is. So here comes the poll again. Lori, are you ready to launch that? I can see it. It doesn't look launched.
Oh, I believe it is launched. Oh, Dr. Rhodes, I did 3 separate polls. That's why you're seeing this. I am launching.
I'm saying I don't see any poll is what I'm saying.
Oh, does everyone else see a poll?
It
or
was
no?
up for a minute and then I
submitted for the poll too.
I
see it.
for number 2.
Yeah, I submitted
And then it went away. So I thought we were waiting for the results.
No, we
as well.
Okay, I have 86% who've participated, but I can stop it and relaunch it if that works, if people can't see it.
Yeah, I didn't actually see poll 2, but can we see a show of hands, a virtual hand, a real hand, a thumbs up if you voted in poll number 2?
Is at 89% now.
Okay. All right. Do you want to stop the poll, Lori?
Sure.
I don't know what yeah. So the next one is navigation and the family, navigating the whole family. Navigation and the family, navigating the whole family. So that's the second topic that we will be taking up. I see Stacy, Jenny, and Luz have their hands up. Are those questions or comments, or are those just the hands up that I asked for to show that you voted? Okay, those hands are down. All right, great. So now the third poll, we're going to be removing family and navigation and the family, because that's a winner. We're going to put it up on the winner board. So here comes the third poll.
Hey, can everyone see it?
Yes, I can see.
Yes.
Right, we're at 55%. Keep the votes flowing. Okay, we have it looks like we got a runaway here. 5 more votes, looking for 5 more votes. And actually probably one of those is Lori, does it exclude the co-hosts and hosts?
Yes, it excludes
Okay.
co-hosts and hosts.
Okay, so we're looking for 5 more votes. We're at 88% currently. I'm going to give you about 30 seconds more. If you haven't voted, please vote. We're at 41 over 45. "20 seconds. 3 more people need to vote if you would like to vote. All right. All right, with 93% of the votes in, your winner in third place is artificial intelligence and navigation, and the impact as well as the role in patient and client care. So those are our top 3. Michelle, I'll turn it over to you to close us out.
Yes, yes, yes. Thank you, everyone. I hope you enjoyed participating in the vote and having an opportunity to shape future meeting agendas. We look forward to delivering on your responses. So I want to thank Amy, all of the speakers and panelists who shared with us today, the work group, our staff, and everyone who participated and joined us and attended or invited 2 people to share. We appreciate having you here today and look forward to expanding this network, and ask that you complete the evaluation form because your feedback is important to us and really helps direct our next steps. We look forward to you joining us. I don't think we have the slide, but we look forward to you joining us at the next meeting, which is going to be on October 9th from 12 to 2 in person at the Women's Cancer Resource Center. So we'll look forward to seeing you there. And we're going to go ahead and conclude our time today.